The lambdoid suture is located in the back of the head in the shape of the Greek letter lambda, similar to an upside-down V. Views are shown of the side and back of the head for further clarification. The premature closure of this suture, also known as lambdoid synostosis, can cause parieto-occipital abnormalities, meaning abnormalities of the back and side of the head, and/or frontal and vertex abnormalities, meaning abnormalities in the front and top of the head. There are two main categories of lambdoid craniosynostosis: unilateral and bilateral. Unilateral lambdoid synostosis involves the premature fusion of just one side of the lambdoid suture. Bilateral lambdoid craniosynostosis involves the premature fusion of both sides of the lambdoid suture. Unilateral lambdoid synostosis can cause flattening of the side and back of the head on the affected side, frontal bone protrusion on the affected side, also known as frontal bossing, and ears appearing lower and farther back on the affected side. Bilateral lambdoid synostosis can cause flattening of the side and back of the head on both sides, a prominent frontal bone, narrowing in the back of the head, and an increase in skull height. Therefore, surgery may be needed if the child has asymmetry of the back and sides of the head, a prominent forehead, flattened top of the head, or an excessively elevated top of the head. This first example of a procedure used to correct the abnormalities from lambdoid synostosis is aimed at correcting the asymmetry of the side and back of the head. First, a piece of the skull bone in the back and side region is removed and reshaped by making small incisions into the bone, like the spokes of a bicycle tire. This allows for reshaping and smoothing of the head as it grows. Then, small incisions can also be made in the intact occipital bone below the reshaped piece from step 1. This also contributes to a smoother and more symmetric back of the head. Next, the cuts into the occipital bone that were just made can even be slightly fractured to allow for more curvature and less resistance. Sometimes the edges of the reshaped bone can be slightly cut to form a new lambdoid suture. Finally, the piece of bone that was cut out and reshaped is secured back into the skull above the occipital bone, and the scalp is closed. This procedure will also treat the flattening of the head that can be seen in children with lambdoid synostosis, especially through the technique described in the third step of this procedure, utilizing the fracturing of the occipital bone. This second example of a procedure used to correct the abnormalities from lambdoid synostosis is aimed at correcting the protrusion of the forehead. All of these procedures aren't necessarily used by every surgeon or on every patient, but techniques like these are used only when necessary for the specific patient's needs. So first, a piece of bone is removed from the forehead region and is reshaped as previously discussed. This reshaping will allow the forehead to grow more smoothly and to be molded more naturally. This third example shows a procedure that may be used to correct excessive skull height in children with lambdoid synostosis. First, drawing our attention to the diagram, the child's face is indicated in blue, the skull is shown in light gray, and the areas of the bone that were briefly removed for reshaping can be seen in dark gray. After the front and back pieces of bone have been removed and reshaped, as shown in procedures 1 and 2, The horizontal pieces of bone are removed on both sides of the head. This is shown by the circled area. Wires will bridge the gap between this newly formed blank space in the bone, and the wires will be tightened very slowly and gently, therefore reducing the height of the skull. The buildup of pressure in the head, known as intracranial pressure or ICP, is prevented here by making the spoke-like incisions in the bone in procedures 1 and 2, which really allows for more flexibility of the bone and decreases the resistance. After surgery, children may be placed in skull molding caps to help secure their skull shape. For further information, please check out my website, GabrielleKellyMed.com, for social media links and a blog. Also, feel free to click on my channel link and subscribe for more craniofacial videos like this one.